Imagine you are pregnant and you just found out that your baby has a birth defect, only because you had one drink of alcohol early on in the pregnancy. This happens frequently and is called fetal alcohol spectrum disorder. It's not really talked about much in movies because it's 100% preventable, and people don't like to acknowledge the fact that it still occurs. I did a study a couple summers ago that looked at the effects of this on rats, and that is how I became interested in the subject. Today I would like to talk to you about what fetal alcohol spectrum disorders are and the levels of severity, the different symptoms involved with it, and how you can prevent this disorder. Fetal alcohol spectrum disorder is a blanket term that describes all disorders caused by alcohol exposure prenatally. All defects include behavioral, cognitive, and physical defects as defined by the FASD Center. There are different levels of disorders. The first one is alcohol-related birth defects, which is the least severe. Then is alcohol-related neurodevelopmental disorder. And you have fetal alcohol effects and fetal alcohol syndrome, which is the most studied and the most severe form. It is also the most thought of form because it contains the physical defects. A study by Abel and Hannigan looked at the factors that cause this disease besides just the alcohol exposure. They found that parental care, genetics, and socioeconomic status affect a person getting this disease. Now that you know what it is, I'm going to discuss the symptoms of it and show you how they affect the different disorders. The level of the disorder depends on the number of symptoms and the severity of them. Streisguth showed that the behavioral and cognitive defects are shown first. He did a study of 415 individuals throughout a lifetime and showed that their behavioral defects. 61% of these individuals disrupted school, 60% had trouble with the law, 50% were involved with confinement in a jail or institution, 49% involved in inappropriate sexual behavior, and 35% had alcohol or drug problems of their own. Cognitively, not all individuals affected with any of these disorders are considered mentally retarded. IQs range from retarded to even the high average. But they were compared with other individuals with ADHD, and individuals with fetal alcohol spectrum disorders have a harder time grasping new information, while people with ADHD have trouble going between different types of information. For the physical symptoms, they are only shown with fetal alcohol syndrome, which is why in movies or TV shows, if it is ever shown, it is shown to be this most severe form. The study by Astley and Clarence showed the different phenotypes, or how people appear, of if they have fetal alcohol syndrome. They have a smooth philtrum, which is the area between your nose and upper lip. Normal people have it where it's bumpy, but if you have fetal alcohol syndrome, it is smooth. The fetal alcohol syndrome individuals also have a thin upper lip and small eyes. There are also differences in brain formation. They can have an abnormally small brain, or they can have an abnormally small head due to an undeveloped brain. Now that you know these different symptoms and how they relate to the different disorders, I'm going to discuss with you prevention. This is important because these disorders can be prevented 100% just by having no alcohol during pregnancy. It does depend on risk factors because there is no known safe limit for alcohol consumption during pregnancy. If you have one drink of alcohol, your child could have fetal alcohol syndrome, where somebody could be a binge drinker during pregnancy and their child could be perfectly fine with no effects. It could depend on those risk factors like parental care and genetics and the socioeconomic status, but there isn't enough studies to show what the safe limit of alcohol is. Doctors are trying to reduce the amount of alcohol consumption in any women of childbearing age, just so that this risk is decreased, because you may drink before you even know you're pregnant. Also, doctors' care early on in pregnancy is important because it increases the awareness for all risks. Today I discussed background information characterized by the symptoms and prevention. So if you're ever in a situation where you might be pregnant and are offered a drink, think about this presentation and how it could affect your child. Thank you.